Good afternoon. Welcome back to TADHack Global 2017, here based at Brisbane QUT, sponsored by Queensland Foundry and Oracle. My name's Jason Lowe, and I'm here with Kara Burns. How are you?
I'm good.
So, we first met through one of the evenings down at River City Labs at the Hacking Health post event. All right, so just tell me what your involvement there and why were you there?
So I was involved with Hacking Health because I'm a contributor to the Health Informatics Society of Australia. So I'm one of their volunteers and one of the contributors to building momentum for HISA here in Queensland. And HISA had were promoting the Hacking Health event, and I felt that QUT with our Foundry and with our ecosystem would actually be really interested in being involved. So introduced HISA and QUT, and we had a series of events, or one of the events at QUT. So part of my role at the actual Hacking Health event was to work with teams as a sort of an advisor, really trying to communicate to them the importance of understanding the perspective of the healthcare consumer. Because my background is, originally I was a medical photographer for many years, but I was lucky that a couple of years ago I got a scholarship to do a PhD here at QUT. That was in a business school, and so my interest turned from, you're working at the coalface of healthcare to actually thinking about healthcare consumers, what they wanted, and what the potential was for them, in healthcare generally.
So what I found out, even just Hacking Health, a fair number of the hacks that were, the solutions that were done were actually consumer focused. Yeah.
And so what we're finding is that consumers are really interested in engaging in healthcare now, and they're doing it through digital devices. Majority of people have a smartphone. They're interested in downloading apps that support their healthcare activities. They're sharing information with family and friends, and this is really leading to an overall increased awareness of healthcare for healthcare consumers.
Yeah, so one of the things I found interesting at the exhibition hall was the iHealth stand. So iHealth have these personal devices. So we actually got one of them here in terms of a blood pressure monitor. But even through that, I've actually have one of the oximeters at home to actually, one of my children actually has issues, sometimes has respiratory issues, and we've had incidents in the past that having that information and the power of that information was valuable for us, not just to know that there's the data, but just what can we do as parents. There's so much unknown when you have to call 136, call up the hospital, do you go to a doctor, do you go to emergency ward, what's the right information. So having that there actually gave us a peace of mind in terms of what there is. And there's a powerful message there. Yeah,
and that was really what I was looking at in my PhD. That was my research. What you're talking about is an instance of collecting patient-generated health data. And I, even working as a medical photographer, started to see patients come in with their own photos. And it really signalled a shift in the way consumers were acting. And so I was interested in looking at patient-generated health data, specifically what it did for consumers, looking at this idea of engagement. And engagement is a term that's used in healthcare a lot because we know that engagement leads to better health outcomes and reduced healthcare costs. But what it actually is very nebulous. It's one of these terms that's thrown around. It could mean involvement, activation, participation, a whole range of things. So I had a look at what this data did for people, and you just said, yep, it gave you peace of mind, and that was one of the clear things that came out of the research. In fact, patient-generated health data helped really the emotional side of the healthcare journey for patients. So traditionally, patient-generated health data is used by doctors. They get the data, they might use it to aid diagnosis, but through my research I was able to show, well, no, patients are using it for many other reasons. These are emotional reasons, so they're using it for reassurance. Sometimes they're using it to make light of a situation, so they share it altruistically with other people who are sick because they want, a community to benefit from their data. They're using it just for empowerment. So quite often healthcare systems can be really disempowering, and so there's those emotional reasons, but there was, ideas around understanding healthcare and understanding their journey, They used it to, for social support. There's lots of instances where people are sharing data now and crowdsourcing, ideas, They also did use it for self-diagnosis, which, clinicians do have a bit of a problem with in some cases if the diagnosis is wrong. Yeah. And they are also using it as a queue for service assessment. So, I did my PhD in a business school, so I was interested in how it impacted the service. But what was happening was people who were allowed to integrate their data, were allowed to bring their opinions, were actually seeing that the services went over and above what they expected, especially in a public health care context. So, really the data had an amazing amount of uses for just the patient, and all of that leads to a greater sense of engagement. So that's why it's really important that we use this data and integrate it into our healthcare systems.
So one of the stories I found as one of the other mentors at Hacking Health was providing the patient or the parents of the guardians of that patient, especially when you're talking about kids, is actually articulating what the symptoms, what the information that the service requires to actually get to the result quicker.
Yeah, and so one of the things that the data leads to is efficiency, and it's efficiency for the health system, but it's also efficiency for you as a healthcare consumer. So you can start sending data to your doctor by distance rather than having to go to an appointment, sit in a waiting room, then decide whether there's actually a need for an intervention. So, part of the direction that Australia is going in terms of digital health is to have greater access of the My Health record. So the Digital Health Agency is really, focusing on this place and this space, and one of the functions of that will be allowed to upload patient data so that then that can be accessed by healthcare providers to provide that efficiency.
So what does that mean in terms of the generate data? What does that give in terms of, does it give more information? Do we necessarily have to see a doctor all the time? There's information that's flowing all the time. We've got these wearable devices, that kind of concept that comes into play in terms of what your overall health is.
Well, I think there's kind of two divisions around the way the data can be used, and that is it can be used obviously for diagnosis and management, very much directed by doctors, and it's about dealing with a disease once it's there. But there's also the preventative side, the health side as well. So they're looking at collecting data to support wellness activities. Now, obviously, current healthcare systems and providers have limited time, so if you're generating heaps of data, the data that you generate needs to be really meaningful. You need to ensure that you can adequately come to clinical decisions from that data. And so this is, I think, part of where Australia's at in terms of integrating data, is looking at how can we provide meaningful data to doctors at the point of care to get the clinical decision making that we need, but not overwhelm them with too much information and make their processes, which are already very difficult, more laborious.
So ultimately, from a practitioner's perspective, they've got so many appointments through the day. We just need to make sure that patients and people that do need to see them can actually see them in more efficiently. So.
And I think that in a remote context, we're already seeing that. We're seeing telehealth initiatives, especially in places like the Northern Territory, really, save millions of dollars when it comes to not flying somebody in to do a face-to-face appointment. And for people who are digitally literate, having that appointment by distance really, really does help. So
one of the challenges that we have at TADHack in Australia and New Zealand was actually focus on my personal health data, but also connecting the broader health industry, not necessarily just the medical side, but even your support community services into that to actually contribute where you are remote. Right, so it is something that it is important. We've had a couple of different cases where we talked about people in remote, rural locations and how do we actually support them as part of the global community. So it is important that we actually provide technology and the communications as well as the emotional services of sorts to these people.
Yeah, and I think patients are good at finding other patients. like them. You know, we have the Patients Like Me initiative in the US where patient groups get together and they can support each other. And I think part of what TADHack can do is help develop those technologies that can link people up, possibly outside of, you know, the My Health record system, but ideally feeding information back into those portals. That one centralized, you know, place of truth would also be beneficial.
So once we've got the data there,
Yep.
then from a futures perspective, what are if you had to blue sky something, what would that be? Because I know in a technology sense, we see a lot of information around, and a lot of people looking at machine learning, artificial intelligence. So as an example, down at River City Labs, Maxwell MRI, where they do diagnostic imagery analysis for prostate cancer. Right? So as an example, they're using machine learning on image processing and the like. I suppose there's opportunities like that. So what do you see in terms of the next stages once we've got the data?
Well, I think from the perspective of patients and from healthcare consumers, what they're looking for is real-time decision-making tools. So counterbalanced with privacy, because obviously that's a big issue. So they're looking for ability to make sense of the data, so obviously developing those mechanisms to pull out the meaningful information, and then actually being, you know, warned perhaps by a digital coach that they need to actually start making interactions. You know, if they have a history of heart condition and they're feeling dizzy, then they need to, you know, take actions like sit down, you know, talk to somebody, you know, call a healthcare provider. And I guess on the provider side is then having triggers that will then tell the provider, yeah, this patient is experiencing these conditions, perhaps there needs to be an intervention here, here's the information. We're not giving you the last 40 days, we're only just giving you the last 4 hours. Go through it and see if, you know, we need a pharmacological intervention or if they need to come into the hospital. I think that's it. I think it's about the real-time management of that, in our health system.
So that'd be very, I suppose, what the real-time decision in terms of consumer side, how do you see that plugging into the broader health system in terms of when you do need to actually include services based upon that? Then that can be quite a tricky proposition when you start looking at it.
Yeah, I think that, well, I think there's an issue around trust. So consumers are always going to go to the providers that they trust. So it'll be the pre-established relationships that allow them to, you know, go to their services and, you know, access the care that they need. But I still think that consumers will expect this. So I think that it's actually up to the health systems to be able to alter and negotiate, you know, that their perspective and their desires, because, you know, consumers are ahead of healthcare in terms of generating the data, sharing the data, and what they expect in a service. So, yeah. So
it'd be a journey for the next few years and next 5-10 years in terms of where we can go with this, in terms of the data that we collect, how consumable it is. So we actually got Professor Rafael Gomez coming live from Germany talking about the emotional side of wearable technologies coming up.
Great.
So having that actually as part of not just some tech that I put on my wrist, but something that is already pre-integrated into the fabrics of what I've got and in the environment, collecting the data, helping to actually make a better life for the people that need it. So
absolutely, obviously counterbalanced with the privacy and making sure that the data is only used as you want it to be used, ensuring that you have full control. And I think that's another underlying issue or theme around patients generating data, is the fact that they now have control of who that data is actually shared with. And this, again, provides some concern with the healthcare providers who are used to having and maintaining the medical record and the control of that and who shares that. So there is a bit of a reckoning going on between, you know, the power or the control that that is within healthcare shifting it from the service over to the consumer. So, but ultimately it's something that empowers people to be more active in their healthcare, and I think ultimately, given the costs of our healthcare, this is probably a direction we need to go in.
So it sounds like there's even just that, some of those cultural undertones of people engaging and being very conscious about their own health actually probably helps the whole community at a whole in terms of health services and the money we spend on health, or the education programs and understanding what your personal health is about. It sounds like it's going to lead to a better community and better health outcomes for everyone.
Yeah, and we have to not forget about the people that are not digitally literate as well. So there are now initiatives in the US around digital health widening participation and actually providing mechanisms and programs that really share with people who may not be as digitally literate as the majority of people, mechanisms and reasons and motivation to actually go and become digitally literate. And I think that in moving to a My Health record and creating pathways where information can be shared securely between patients and providers, giving people in remote communities options to access their healthcare providers from home, all of that needs to happen with an understanding that consumers are all different, and the ones who are falling behind are probably the ones that need the service the most. So we really need to emphasise, or governments need to actually create initiatives around this as well.
Okay.
Yeah.
Well, thank you, Cara. Thank you for joining us on the couch here
Pleasure.
In Brisbane, QUT Foundry. And we'll see you later on. Thank you.
Bye.
Up and